In this test, air conduction of the ear is compared with its bone conduction. A vibrating tuning fork is placed on the patient's mastoid, and when he stops hearing, it is brought beside the meatus. If he still hears, AC is more than BC. Alternatively, the patient is asked to compare the loudness of the sound heard through air and bone conduction. Rinne's test is called positive. When AC is longer and louder than BC, it is seen in normal persons or those having sensory neural hearing loss. A negative Rinne test is seen in BC-AC conductive type of hearing loss. Also, false negative Rinne's test is seen in severe unilateral sensory neural hearing loss.
Weber test. In this test, a vibrating tuning fork is placed in the middle of the forehead, or the vertex, and the patient is asked in which ear the sound is heard. Normally, it is heard equally in both ears. It is lateralized to the worse ear in conductive deafness and to the better ear in sensory neural deafness. Absolute bone conduction, ABC test. Bone conduction is a measure of cochlear function. In ABC test, patient's bone conduction is compared with that of the examiner, presuming that the examiner has normal hearing. External auditory meatus of both the patient and examiner should be occluded by pressing the tragus inwards to prevent ambient noise entering through AC route. In conductive deafness, the patient and the examiner hear the fork for the same duration of time. In sensory neural deafness, the patient hears for the shorter duration. Schwabach's test. Here again, bone conduction of patient is compared with that of the normal hearing person, examiner, but meatus is not occluded. Schwabach's test is reduced in sensory neural hearing loss and lengthened in conductive hearing loss.